Hello, I'm Jane Burns and I'm the Executive Medical Director, and this week I'm standing in to cover the annual leave of Heather Knox, who's our Chief Executive, and she's having some well-earned downtime of annual leave. This week, having worked non-stop since the beginning of March through the COVID pandemic and on through the remobilisation process. I just wanted to take a minute or two to make sure that you're all okay and that you're managing to get some downtime as well, because it's really, really important that we all look after ourselves and our well-being and make sure that we're looking after our colleagues as well, and that in turn of course leaves us in a position to be best placed to look after our patients. So please make sure that you continue to do that. What I really want to say to you this week is very much a follow-on from that. I'm sure, like me, you've been looking at the numbers growing nationally, both across the UK and within Scotland, and with some concern about the numbers within Lanarkshire and neighbouring health board in Greater Glasgow and Clyde as well. Quite a lot of that is due to the schools and then the universities returning, but it would be wrong of us to be too complacent and think that that's entirely the reason. We are starting to see an increase in the numbers of older adults and middle-aged adults too, I'm afraid, and we are starting to see some increase in our inpatient admissions, in our critical care admissions, and unfortunately we have also seen some deaths from COVID-19 over the past couple of weeks as well. Nothing quite like the same rise that we saw in March, so no cause for alarm yet, and I know that we have good plans in place, but now is the time to refresh our practices about looking after ourselves, our colleagues and our patients, and I'm particularly keen to make sure that we refresh our approach to infection prevention control measures, because we have had some staff members who have tested positive for COVID-19, so it's really important that we all stay thoroughly well versed on the current infection prevention control measures. And that leads me nicely into a reminder that this is also flu season that's coming upon us. Every year you'll know that we run a campaign for staff to have the flu vaccine, and every year we have to repeat that message several times over, and the best we usually achieve is about 50% of our staff being vaccinated through that programme, although I am aware that some members of staff receive their vaccines elsewhere. This year we have to do better, and we must do better. It is possible to get both flu and COVID-19 simultaneously. The evidence shows us that now. And there is some recently published evidence that if you get both, then the outcome from either is much worse than it would be if the body just had to cope with one at a time. So it has never been more important to make sure that you are protected from flu. We don't yet have a vaccine for COVID-19. Clearly we're hopeful that one will come soon, but there does need to be a window of 28 days between flu vaccine and the first dose of a COVID-19 vaccination, and the likelihood is that the COVID vaccination, when available, will require 2 such doses. So it's important that we get early flu vaccination of as many of our staff as we possibly can, to please, please, please make sure that you sign up for the staff flu vaccine campaign. Look after yourselves, look after the well-being of your colleagues, and let's make sure that we're all in the best possible place to look after our patients and the population of Lanarkshire. So thank you very much for everything that you do as ever, and have a good weekend.